Position a client from supine to lateral. The nursing team enters the room and greets the patient. Introductions are then made between each nurse to the patient. The patient then mentions she is feeling weakness on the right side of her body and would like to be repositioned to alleviate that pain. The leading nurse is explaining what we're going to do by pulling her closer to the right side to alleviate some of the pain on the left side and putting the bed rails down. And now we are going to confirm the identity of the patient to make sure it matches what we have, the date of birth and full name. And now we're going to put the bed rails down and begin with moving the patient from supine to lateral. We now have another nurse given instructions on how to move the patient on the count of 3 using the soaker pad. And there we go. The patient is now moved closer to the right side. The patient looks comfortable, and now we're going to remove the pillow to reposition her body. At this point, we have another nurse giving instructions on how to reposition the body and move the body in a way to help alleviate the pain. She's now giving them more instructions on how to cross their arms and help move the patient closer to the left side of the bed, and we can now try to help alleviate the pain on the right side. On the count of 3, they turn the patient over, and now we're going to add some pillows to help with supporting her, beginning with the head. And right after that, we're going to put a pillow right between her legs to avoid any kind of pain that she might be feeling from her ankle and her knee touching, her back, as well as her arm. At this point now, we're going to check with the patient if she feels comfortable, if she feels okay, and we're going to put the bed rails back up alongside with her blanket. And we're going to move the bed down back to the original position. We position the call bell close to her, so if she has any problem or needs any help ambulating, she can ring the bell for any assistance. And here we are lowering the bed. This position is supine to lateral on the left side. Positioning the client from lateral to supine back to lateral. The nursing team is now entering the room to help the patient. The nurse is now checking with the patient how she's feeling and asking her what needs to be done. And the nurse is now checking her identity to ensure that she's matching her name and her date of birth. The nurse is now telling the client that we are going to move them accordingly to help with the pain. Here you see all the other nurses helping to remove the pillows and the blankets and helping to introduce themselves as well to the client. Once the pillows are removed, the nurses will then reposition the client through moving the soaker pad to ensure there's enough space for everyone to work in a safe manner. They are now repositioning the client towards the left side. On the count of 3, they will move the client towards the left. They are now realizing that they have to reposition the client more towards the right side to put the client back in a supine position. The nurse is giving instructions on crossing arms and turning the client over. At this point, on the count of 3, they turn the patient. Realizing the patient is too close to the right side, the team swiftly makes the move to move the patient closer to the middle of the bed to ensure safety of the patient. Once the patient is moved to the middle, they reposition her a little bit and they give her clear instructions on what is coming up next. The nurse is explaining and getting consent to move her arm and then telling the nurse to move her leg and giving clear instructions to the nurse beside him on how to grab the patient and reposition her body. And both of them will cross their arms and reposition the body on the count of 3 to get the client in a lateral position towards the left side. The nurse is communicating to make sure everyone moves at the same time to ensure the safety of the patient. On the count of 3, and here we go, the client is turned over to the left side. Now the nurses are going to reposition her by putting pillows surrounding her back, surrounding her under her leg. Now they're going to place one under her arm, check with the client how she's feeling, cover her up, and let her rest for the night. And that's how you move a client from lateral to supine back to lateral.